After our initial ideas that we had between the two practices, the resilience support facilitated more sort of focus meetings to prepare us for the full merging process. We prepared a full action and mobilisation plan. As a practice manager, the merging process is not quick and it's not easy, it's a lot of work. And with the resilience support that I've had, I've been able to focus on the important areas as well as managing the practice on a day-to-day basis.
In particular, we recognize two areas. One is that we've been involved in the NLP training, which to me has been incredible learning curve, both professionally and personally. I've been able to develop different strategies to talk to patients and to try to speak to those more aggressive patients, and even I've been able to bring it back to my children, how to talk to them and how to train them into be better person, basically. With regards of the other area, we've been concentrating on revisiting those processes that we have in the practice, that they've been going on for years and we don't really even think about them. But when we think about it and we stopped and we look at them, we noticed that there was loads of things that could be improved. So for example, we took a few sessions to look at the way that we organize diabetic care in the practice, and how we got a diabetic diary that is the center of the diabetic care in the practice, and how over the years there has been loads of different small processes that have been sort of going on top of that diabetic diary and have made the process very clunky, very confusing, and not everybody knew what everybody else was doing. So what I said at the beginning, that the fact of stopping and thinking and meeting as a team is made a great difference, is basically enlightened by that example. The fact that we're able to sit in a table with the nursing team in particular, and we're able to draft how the pathway of a diabetic patient goes around the surgery from diagnosis all the way to insulin initiation and annual reviews and the rest. And then being basically open-minded to say, actually, how could we improve it? How could we improve the journey for the patients, and how could we make it more efficient for us?
This program, the fact that the staff had a chance to speak confidentially with the team, and they were helped through to bring about their grievances if they had any. But not only that, once that was done, we got a feedback. And this feedback helped us tremendously, just understand exactly what the staff wanted, exactly how to move forward. And it wasn't something really big, but the little things, like communication, or sort of just passing on information from a member of staff, maybe to the doctors, small things like that. It really helped us sort of move forward, and every time we do something, we actually think about it now, us as bosses, if you want, myself and the principal GP. And it really helped our practice and the members of staff. The morale was great with it. And then we had the away days, we had 3 of those, and working as a team. So the outcomes of this whole program was for us to be able to retain staff, which we did and we have done. We've got 2 sites that we're working across, but at one of the sites we actually have 2 practices. So we've got Greenhill Park and St Andrews. And just for them to work together and rotate and bring stuff over without having a separation that, one practice is St Andrews and the other one is Greenhill, so we cannot actually mix. So with this, it really gave us the opportunity to be able to do that. And my staff gave me feedback, and they were really grateful that they've had this opportunity to work with the resilience team. So that was.
I think looking forward, I think it's important that we realise that in primary care, the actual team is we're looking at non-clinical as clinical aspects, and the way the program helped us is recruiting these non-clinical and clinical. So I'm a pharmacist, okay. So I think looking forward, more practices will have pharmacists, and the actual program highlighted that. And for us to have a micro development team was highlighted.
Yeah, so exactly. I think developing the new skill mix was one of the solutions to the problems we are facing with the less GPs in the recruitment. So obviously, that's one of the things we were able to focus, which is a new role to the primary care. So that help from CCG definitely kind of developed the roles in the practice and improved.
I also felt
services.
that when they did come in, it wasn't like you do this, you do that, you do that. They actually listened to us and worked with us as a practice,
Yes.
you know.
Another bit of help we got was with the admin side of things. So we had help with the scanning processes and with the prescription processes. And at the time, we were struggling to get everything done from an admin point of view. So having someone come in and make us look at everything we do with fresh eyes was really helpful. And we cleared a lot of backlog of work and updated our rotas and things like that. So having fresh eyes was really good in that term.
Yeah, it was enjoyable too.
It was really enjoyable.
The repeat prescription process also was quite a long-winded process, and we've managed to sort of streamline it quite well.
Yeah, I mean, the message that I would want to give other practices is that if they see this backlog, then they might consider recruiting more staff. But actually, what this program allows you is to utilize the staff that you have, then break it down, so you can use the same staff and be able to, deal with the backlogs without having to recruit.